Vanakkam, the South Indian is here. You know, unless you recognize your past, your present is not going to be very pleasant. And of course, it's an obvious, it's a given that even your future will not be as comfortable if you do not recognize what happened in your past. And I'm only talking in the context of the COVID pandemic here, the way the world had shut down. Is it time yet again? We shall figure out. In May of 2023, when the head of the UN World Health Organization WHO, Tedros Ghebreyesus, declared with great hope an end to COVID-19 as a public health emergency, there was overall jubilation across the world. But then, ladies and gentlemen, that was only the first part of the statement. In the second, Tedros had added that it does not mean the disease is no longer a global threat. He had said, and I shall quote him here, "It is still killing and it is still changing. The risk remains of new variants emerging that cause new surges in cases and deaths." Let's not get emotional here, very prescient of him, even as a new COVID-19 subvariant JN.1 has reared its head in India. As of now, 21 cases of the COVID-19 subvariant JN.1 have been identified nationwide, with Goa right on top, followed by Kerala and Maharashtra. What makes the situation particularly prickly is that it's the festive season, during which the traffic of people increases across every medium of transport. Now, let's take a look at the statistics. These are basic statistics, and like I said, we don't have to get emotional, we don't have to get panic, we just need to be very practical and be smart about it. Now, I was talking about statistics. On 16th of December, Kerala reported 302 new cases, and this was an increase from 10th of December when the state had reported 109 cases. So, what we actually saw was daily new COVID cases which started to cross 200. There is of course an existing caseload of COVID-19 cases. See, there are two things which are happening. One is the new subvariant and the other is COVID-19 cases. There is an existing caseload. As of December 20th, 2,305 active cases were registered across the country, out of which Kerala recorded 2,041 cases, while Karnataka had 79. With this added burden of a new subvariant, it only becomes an uphill task, as it were. So, let us first briefly understand what is this subvariant. So, what do we know about this particular new subvariant? For one, it is considered to be a descendant of the Omicron subvariant BA.2.86 or Pirola. Going by its trajectory, it was first detected in the United States in September of 23, and later China reported 7 infections of the same subvariant as recently as 15th of December. The subvariant was identified in a woman in Kerala, raising concerns even as the Union Ministry of Health initiated preparedness measures. Now, what is also being said is that the BA.2.86 has a total of 20 mutations on the spike protein, which is a cause of concern. Now, the thing is, I know it all sounds like Greek and Latin, but we are going to have experts on the show. These are doctors and who shall decode it for us. Now, what are its symptoms? On your screen right now, if you look at these symptoms, there is mild fever, there is coughing, there is discomfort in the nasal passages, and of course, there is sore throat, there could be runny nose, pain or pressure within the face, headache and gastrointestinal issues. Those are the symptoms of this particular subvariant, a new subvariant of COVID. Even as health ministers of Karnataka and Kerala, Dinesh Gundu Rao and Veena George, are doing what it takes to put a lid on rising infections, let us try and understand what exactly is this new variant.
We had a discussion with the Union Health Minister and all other ministers, and basically they have asked us to continue our preparation, keep vigil, increase our testing, and ensure that all oxygen and beds and ventilators and all that is all in place. And any major outbreak, the government should be prepared to handle it. But they are saying this variant has been the JN.1 variant. It's been around for almost a few months now across the world, and there's no need to panic. It's a subvariant of the Omicron. So just keep testing more. Karnataka is now the highest in India in number of tests in the last 24 hours. So we have a target of increasing it to 5,000 by Saturday. So do test more, find out more, and then later on we can see what else to do. It's no guidelines, no restrictions on movement, no restrictions on gatherings, all that. But we advise precautions for people. Our advisory is to take precautions for people when they are in crowded places. Better to wear a mask. And that advisory we have already given.
Now, Karnataka Chief Minister Siddaramaiah also chaired a high-level meeting with Karnataka COVID Technical Advisory Committee over the spike in COVID cases.
Myself, Deputy Chief Minister, Home Minister, Health Minister, Medical Education Minister, and other officers of the Health Department, and also the members of the Technical Advisory Committee. We met today and discussed so many things. We have taken a decision that this disease, we need not be panic. People need not be panic. But precautionary measures will have to be taken. Wherever there are groups and in gatherings, in such places, everybody should wear mask. And the 60 and above years old people
with comorbidities,
and compulsorily they should wear mask. So far in Karnataka, 92 cases are found. Out of 92, 72 patients are in isolation, quarantine, home isolation. Only 20 are in the hospitals. Out of 20 patients, 7 are in ICU. They are not having the only COVID diseases, other associated diseases are there. That is why they are in the ICU.
Good that the Chief Minister of Karnataka is himself wearing a mask. India on Thursday reported 594 fresh COVID-19 cases in a day. On Wednesday, the Union Health Ministry officials revealed that the Indian Council of Medical Research, or ICMR, is actively engaged in the genome sequencing of the recently identified JN.1 variant of SARS-CoV-2. As of now, 21 cases of the COVID-19 subvariant have been identified nationwide, according to Dr. V.K. Paul, who is a member of Niti Aayog Health. He underscored the importance of states enhancing testing and reinforcing surveillance mechanisms, emphasizing the close scrutiny of the new variant by the scientific community in India. As many as, like I said, 21 cases of the new variant have been detected across the country until now. Now, he also said that there was no need to panic. He said that the scientific community in India was investigating very, very closely, and he said that we just need to ramp up testing and strengthen, of course, surveillance systems. He highlighted, that is Dr. Paul, that about 91 to 92% of those infected are actually opting for home-based treatment. According to official sources, 19 cases have been traced in Goa and 1 each in Kerala and Maharashtra, there have been over the past 2 weeks 16 deaths related to COVID-19 were recorded, with the victims having serious comorbidities. The centre has asked states and union territories to see that it is all seen very carefully. Also, Health Minister Mandavia reviewed the preparedness across the country and said we need to be alert, we need to really keep talking about testing, testing and testing. You know, the other thing which is really happening is about how it's a festive season. People are actually traveling from one place to another, and that could be one of the reasons why there is generally a kind of a scare. So, therefore, we need to understand what it is, and you know, therefore, the scare is that whether it will be just like what it was 3 years ago. So, let me now go to the guest. Dr. H.M. Prasanna, President, Federation of Private Hospitals and Nursing Homes Association of India, is joining us. Dr. P.S. Indu, who is Head Community Medicine, Government Medical College, Trivandrum, Thiruvananthapuram rather, Kerala, and Dr. Shekhar Salkar, who is member COVID Task Force, Government of Goa, and Oncosurgeon, Manipal Hospital, Goa. A very warm welcome to all of you. I want to go to Dr. Salkar first. Dr. Salkar, Goa seems to be right on top, nothing to panic. This show is not about panicking at all. We all need to be very relaxed, because panic is the first indication that, you know, we are on a on a downhill. So, tell us, I mean, Goa, is it because of testing like Kerala? You know, this show is called the South Indian. A lot of my North Indian friends ask me, how come Kerala? I said, that's because we test, you don't. So, I mean, so that's the scientific and logical reason. So, Dr. Salkar, do tell the viewers about what is the situation in Goa like, and how difficult is the festive season making it for you, Dr. Salkar?
I don't think anybody has to worry for this as of now. The time is an important factor. The more the time goes, the we will know how it actually behaves. See, the number may be anything, but important how fatal it is, how bad it is, how much damage it causes to the lungs or other organs. That will be most important. As of today, we don't have anybody admitted in the hospital for that. They are all having some mild symptoms only. So I don't think there should be any problem. But December itself is a heavy season for us. It's a tourist season, as well as Christmas is coming nearer. We had a film festival recently. We will be having a sunburn festival in just coming few days. So we are just giving our advisory that we should be careful. Chief Minister and Health Minister both have taken a high-level meeting, and they have said that as of today there is nothing to worry much. But as I have told you, whatever government guidelines are there, individual has to take its own precautions. If you are above 60, or if you are suffering from cardiac disease, you are suffering from diabetes, kidney problems, cough and cold, and if you have asthma, bronchitis, all these people have to take care of themselves. It is not that just because government says,
you know, but Dr. Salkar,
you are just free.
Dr. Salkar, I have said Christmas, of course, in Goa is beautiful. It's a festival. But you know, I read a lot on a social media platform about the music fest. I think, you know, the music festival, I do not know whether the government is going to take a stand and kind of, you know, come down heavily, because festivals, I understand, I don't know, I don't want to make it political, but I think I read about how a lot of opposition leaders were talking about why this festival. Let me come back to you, Dr. Indu. A very warm welcome to you, Dr. Indu. You know, this subvariant, we are reading different kinds of reports. I read around 15 of them. It says that, you know, this is a part of a lineage that includes well-known variants like Omicron. Also, what does variant of interest mean? You know, sometimes these terms jump at us and we are scared. So, just make it easy peasy for the viewers, you know, because at the end of a long article, then there will be 2 lines. Nothing to panic, just take care. But the thing is that you've scared me enough.
Actually, the SARS-CoV-2 virus is evolving. Evolving means it is changing its dress, the shape, So the same person, it's the same person, but comes in a different, just like, several photocopies are taken from a paper, some small changes might happen. So whether these small changes are important enough in terms of public health. It can be in the transmissibility, the speed with which it spreads. It can be in severity and seriousness. More number of people get infected, go to ICUs, need oxygen, then the death. So these are the important parameters based on which we categorize a new variant, a new change as variant of interest, variant of concern, etc.
Right.
So this is a variant of interest because it spreads faster.
Yeah. So Dr. Indu, I wanted to ask you, but then correct me if I am wrong, but apparently Thiruvananthapuram and Kannur, these are the two districts which are particularly vulnerable. Am I right, or not really? Has the scenario changed now?
It depends on from where the initial cases are detected. Actually, we have a good surveillance system. We continue to test symptomatics. In addition to testing other measures like wearing the mask in hospitals and all, now all the patients wear masks, doctors, nurses and all our staff wear masks. So those are all general measures which will help us to protect ourselves, whether it is the current variant or the upcoming variant. Variant of interest may become a variant of concern, but those protective measures. So some districts definitely, depending on the population density, population mobility, presence of airports, all those will determine.
Let me now go to Dr. Prasanna. Dr. Prasanna, how are you? Long time. Are you well?
Yeah, long time. I'm good. Thank you.
Dr. Prasanna, you know what Dr. Indu said, I want to ask you, is it true that we don't have to panic, Dr. Prasanna? You and I have done a lot of shows on COVID in the past.
Yes, 100% I am with Dr. Indu and Dr.
Yes,
Salkar.
but let me ask you,
not panic at this time.
Dr. Prasanna, but it says that the variant has the capability to spread rapidly, and what is scary is that it can evade immunity. Therefore, it has to be monitored constantly, because there is a, India is a large country. So, please explain this. You say don't panic, but you say it will spread rapidly. It also can actually, evade immunity. What does this mean?
Yeah, definitely this is creating a little bit of confusion among the medical fraternity as well. So, better is prevention. We request everyone that to follow all the COVID guidelines which were issued in 2020 when we first had the first wave. So it's better to wear the mask when we go outside, out of the house, and all people above 60 and who have comorbidities like diabetes, kidney problems, and who are on cancer chemotherapies, they should wear a mask. And even to all our hospital staff, we have given an advisory to wear masks. So prevention is the best thing because it's highly transmissible. That has been proved. But how threatening it is to the life, we are still about to evaluate it over the next few days. But of late, in the last 1 week, what we have seen even in Bangalore is we are seeing admissions related to COVID happening. So we need to step up our vigil and we have to keep the precautionary measures in position.
Yeah, which, your health minister Dinesh Gundurao has been saying that there has to be testing, and they are very well prepared. Dr. Salkar, tell me something. It is so confusing. If we can put up the symptoms, please, for this new subvariant, which is about, running nose, a bit of, sore throat, a mild fever, headache, there is coughing, there is, kind of discomfort, etc. How do you know that you have to go get tested? See, when we were living in the era of COVID, sir, Dr. Salkar, even if I don't, they would say go test, you will have it. But now, after 3 years, how does one go and do it? I don't know. Kerala has fantastic surveillance. But then, as a doctor, what would you advise people? Like if your fever
for last 1.5 years, we have been seeing a lot of patients which are having cough, cold and other things, and they are not responding to any sort of treatment as such. And they continue to have the cough cold for almost a month or so.
Oh my
So
God.
we were expecting some sort of mutation will occur to this COVID virus, and it has come in the over a period. This is going to happen, I think, till some more time. That will be going on changing and mutations and different variants will come. My only problem is, even if this spreads faster, the problem is for those people who are having problems like cardiac and other thing what we have mentioned. But for a normal patient, it may not have, normal people, it may not have a significant impact. But important part is, as you said, those who are already on therapies or something, they have to take care of themselves. See, government may issue a lot of advisories. In the end, it is your concern, your body. You have to take care of yourself maximum. So you know you are not well, you don't go to the functions which are attended by so many people. If you are healthy, well and healthy, please take a mask with you anywhere. If you're going, somebody is coughing, just turn yourself away or go away from him. These are very simple things which has to be done. But as I have told you, COVID has baffled us last time, first wave, second wave, Omicron wave, they have baffled all the medical community thoroughly. We have, whatever everybody may have said, but nobody was knowing what was actually happening there. Now, whatever treatment we had given, they say that it was not needed. So, a lot of things will happen. As a new thing comes up, it's a time which is important. The more the time goes, when there is no more significant fatalities coming, then we know that, this is under control.
All right. Dr. Indu, also this is, it says it features an extra mutation on its spike protein. Now, when you read all this, when you read spike, I can only think of spikes on my head. Also the thing is that it's, okay, so it's like this. You say it's an easy exam, you don't have to really study so much. But the point is that if I study even that one lesson, I can't understand any of it. So this whole thing about extra mutation scares you, on its spike protein. I mean, make it easy for the viewers, because there are lots of people, that now, more often than not, people read up and get into all kinds of panic mode. So therefore, I am asking you.
There are 2 or 3 important points from the public health point of view.
Yeah.
First is that there is whether the vaccines which most of us have taken will protect us against JN.1 as well. Till the evidence as on now, WHO also has made it clear, whatever variants have come against severity, against hospital admissions, against mortality, there is a protection. But as is seen in US and data from other countries, there is an increase in MISC, which is multi-system inflammatory disease among children and adults. Actually, that is a little higher for this, and there might be a higher spread among children who are unvaccinated. But our concern is more for those who are elderly, those who have other comorbidities. Most of our population have been vaccinated. The vulnerables have been vaccinated, and vaccine does protect against severity to a very great extent. That's one point which the WHO and the available evidence from all the sources have made it clear. The second point I would like to make is that it's not only COVID that spreads.
Okay.
Not only in India or Kerala or other parts of the world, we have the respiratory syncytial virus, the RSV, the influenza, out of which the H1N1. Of course, flu shots are not common in countries like us, but in other countries where it's a pattern to take annual flu shots that provides protection. But in our setting, the H1N1 also might be there. So severe infections are persisting longer with more symptoms like breathlessness, hemoptysis or blood-stained sputum. All these are indications of a severe, whatever be the respiratory symptom, people have to seek care, because there is a very effective drug for H1N1, the oseltamivir, which is available in the government sector. So that is also, RSV is another, respiratory syncytial virus.
It's all very scary.
We don't routinely give a vaccine, but other countries have RSV vaccine as. So they are actually, if we go through the CDC recent recommendations, Center for Disease Control Atlanta, they recommend all the 3 vaccines for the.
All right, Dr. Indu, I'm sorry to interject.
To focus on the mask, yes.
Yeah, Dr. Indu, I have to take a break. So, ladies and gentlemen, I'm talking with Dr. Prasanna, Dr. Indu and Dr. Salkar, and the topic is extremely important, the new subvariant which is J1. So I'm going to come back but in a jiffy, so just don't go away, lots of information coming your way. Stay with us.
वर्ष 2070 तक भारत नेट जीरो का लक्ष्य हासिल करेगा.
There is certainly a wall of capital coming into the clean tech, climate tech space, not just in India but across the world.
This and more, streaming on world's first news OTT, News9 Plus. Download now.
The scale of the attack was something that we were surprised at. David Hadley was a double agent. The Americans did not want him to be fully exposed, so all that he probably shared with the Americans was not shared with us in terms of intelligence. If we had that, I'm sure that we would have been able to deal with the situation far better.
This and more, streaming on world's first news OTT, News9 Plus. Download now.
Bangalore traffic is an example of something that has gone wrong with our system.
We have more than 50 flyovers in Bangalore city. If flyover is a solution to traffic problem, Bangalore should not have traffic problem.
According to TomTom Traffic Index 2022, Bangalore is ranked as the second worst city in the world when it comes to traffic.
The speed limit at the ORR is 80 kilometers per hour, but our vehicle has only moved 10 kilometers per hour.
What Bangalore needs is a surgery, but what we have been offered repeatedly are band-aids.
Only on the world's first news OTT, News9 Plus, ahead of the curve.
वर्ष 2070 तक भारत नेट जीरो का लक्ष्य हासिल करेगा.
There is certainly a wall of capital coming into the clean tech, climate tech space, not just in India but across the world.
This and more, streaming on world's first news OTT, News9 Plus. Download now.
जानना है तो देखिए, समझना है तो सुनिए, सीखना है तो पूछिए, और कमाना है तो खरीदिए. जानकारी, सलाह और निवेश सब एक ही सुपर ऐप पर. पैसे का सवाल है तो जवाब है Money9. आजादी पैसे की. अभी डाउनलोड करें.
Welcome back. Here with the South Indian, and we are discussing a very important topic, the new subvariant of COVID, JN.1, the kind of impact it will have. We're trying to decode it. We will not create any panic. We will see to it that we speak to experts so that you know exactly what to do to the best of your abilities. I'm with 3 doctors and all of them speaking absolutely eloquently. I'm with Dr. Prasanna, I'm talking with Dr. P.S. Indu and Dr. Shekhar Salkar, who is member COVID Task Force, Government of Goa. Dr. Prasanna, tell me something. You know, a lot of people are asking me that, you know, we've got our shots, we've also got a booster. Should we be worried? Because again, the newspapers are reporting that, you know, maybe you will need a booster. So just explain this. I mean, someone asked me outside that all my life do I have to keep taking boosters? Every time there is a new avatar of this COVID.
Sudha, what vaccination has shown in previous episodes and waves also, whoever have been vaccinated, they didn't develop a severe illness, even with COVID infection, which we saw in the second wave and the third wave also. So they need not worry. Whoever have taken a booster dose, they will have a certain immunity to this variant also. Unless a new vaccine comes for JN.1, specifically, I don't think there will be a need for a fresh vaccination for whoever have taken the booster dose. So they need not panic. That itself will prevent a serious illness, and they need to take the precautionary measures. And all high-risk patients who have comorbidities, they need to be tested on priority. That's the only thing to be kept in note, and I don't think there is anything to worry about for the general public.
All right. Dr. Salkar, you are from the COVID task force. A lot of people in my office outside, they came in the break when we took a break and said, hey, listen, we are going to Goa. So tell us, what kind of preparedness do you have in Goa, considering apart from your local population, there is a lot of people, there are a lot of people who are going to come from outside. You are going to be starting a carnival very, shortly. The beaches are going to be full. What is the preparedness you have? Because Karnataka, I've been reading reports. Goa, I have not read so many reports, but Karnataka, they are trying to see that there are enough beds. We do not have chaotic situation like last time when we went short of oxygen. You all remember, particularly in New Delhi, what happened. I mean, lot of people lost their lives. So talk about the preparedness. How many hospitals are ready? Considering Goa is right on top. Ladies and gentlemen, Goa is right on top. Nothing to panic. Goa is number 1, followed by Kerala and Maharashtra so far as this new subvariant is concerned, JN.1. But Dr. Salkar will just tell us, considering he's part of the COVID task force. Dr. Salkar, over to you.
I think our full Department of Health, Goa Medical College and other private hospitals are fully geared for this. Now, all the major hospitals are having liquid medical oxygen, which is already commissioned in all the major hospitals. So there may not be any scarcity of the oxygen. There are a young number of oxygen concentrators which were given last time, which is lying unused also. We have already started oiling them and started preparation of the separate COVID ward, and everything is under control. And plus, important part is that we are now experienced in handling this situation. In level 1st and level 2nd and 3rd waves, second wave, so we were absolutely off guard. But now we are very much sure that we will be able to handle. Yes, December is our festive season. More people are likely to come to Goa than any time in the year, other part of the year. But this is the maximum. I don't think. If you are sick, please don't come. If you are healthy, I feel you are welcome to Goa and you can enjoy your life within your limits and see that is the important. My important point is that there are a lot of young students who were less than 12. We have not vaccinated them thinking they were children. Now in the last 2 years, they have increased their age. So, I think for them at least some vaccination may have been to be issued or not. The guidelines will have to wait and see. But important, I'm stressing, it is the only time which is there. Yes, we have to take a precaution. Please don't worry. We will take care of you. You don't worry, you come freely to Goa.
How nice.
And you enjoy the Goa hospital.
On that note, thank you very much, Dr. Indu. Dr. Prasanna, it's always such a pleasure. Dr. Salkar, great pleasure speaking to you. We've got some breaking news and therefore I had to cut short this particular conversation. We're getting some breaking news and let me tell you what it is. But before that, the breaking news that we are getting, I'll take you to that story. But as of now, the South Indian is focusing on Tamil Nadu. That is the story which is coming from Tamil Nadu. And now the South Indian is going to focus on her own state, that is Tamil Nadu. What's really going on? You know, in a major setback for the MK Stalin-led Dravida Munnetra Kazhagam government, the Tamil Nadu's Minister for Higher Education, K. Ponmudi, as also his wife, Visalakshi, has been sent to 3 years in jail and imposed a fine of Rs 50 lakhs in a disproportionate assets case overturning a previous acquittal by a lower court in the year 2016. Remember this man? This is the same man who made that disparaging remark on North Indians and those who spoke Hindi as Pani Puri sellers. But then Ponmudi is also a man who has a PhD, and this professor turned politician has had a very successful run in the DMK, as he is a 6-time MLA and seen as a highly influential minister in M.K. Stalin's government. Ponmudi had served as the Minister for Higher Education and Mines in the Dravida Munnetra Kazhagam government led by the then Chief Minister Muthuvel Karunanidhi between 2006 and 2011. After the All India Anna Dravida Munnetra Kazhagam led by J. Jayalalitha came to power in the state, pursuant the 2011 Assembly election, the Directorate of Vigilance and Anti-Corruption, that is DVAC, registered an FIR against him on 26th of September 2011. So, what is this case against K. Ponmudi? In July, Ponmudi and his son Gautam Sigamani, who is an MP from Kallakurichi, were questioned by the ED in connection with a 2011 case of money laundering linked to alleged illegal sand mining. The ED alleged that Ponmudi violated the Tamil Nadu Mineral Concessions Act during his tenure as Minister of Mines and Minerals between 2006 and 11, and added that he had allocated an illegal red sand quarry in Manur block valued at around, brace yourself, 28.37 crores. Now, what stood out in this case was that the allegations against him and his wife, Visalakshi Ponmudi, correspond to his tenure as Minister for Mines and Minerals in the DMK government. So, there is a synergy of sort. Following the verdict, Senior Counsel N.R. Ilango, who represented K. Ponmudi in the DA case, said that they will of course appeal against the Madras High Court order in the Supreme Court, and Ilango said that Ponmudi will be released by the Supreme Court. Meanwhile, owing to Ponmudi's sentencing, the state government announced that the Minister for Backward Classes Welfare, Raja Kandapan, will hold the Higher Education Ministry as additional portfolio. Of course, a formal announcement from the Raj Bhavan is to be issued very, very soon. So, that was the other news from Tamil Nadu. I have a breaking news. Listen into this voice and we get there.
We welcome this judgment, BJP welcomes this judgment, and it is a lesson for those who loot the public. And Mr. Ponmudi should have gone home, should have gone to the jail before 3 days itself, but he continued to be a minister, which is shameful. And we strongly condemn the DMK, which has been looting the public, and this is the lesson what they get, and this is called the Dravida model.
And I am taking a break because I am coming back with breaking news. It has to do with Kashmir and Poon. So, stay with us. I will have an expert colleague decoding it for all of us. Don't go away.
तो जब हम करेंगे तो पता लग ही जाएगा। सलमान खान का करेंगे, मारेंगे, जोधपुर में मारेंगे तो पता लग जाएगा।
This is someone who